Hi, and thank you for joining us for our discussion on improving patient access to medications by simplifying the prescription process. My name is Catherine Woodhill. I'm the VP of Marketing for Phil, a patient access platform on a mission to help people get their medications quickly, easily, and affordably. My background is largely in tech, and prior to joining Phil, I worked in tech companies of all sizes, really focusing on building and scaling marketing organizations. But as a patient, I've dealt with chronic complicated illness and struggled to get the medications that I needed. And I've really watched, others in my family experience the same thing. So when I was introduced to Phil, I was really excited about the opportunity to experience a new industry and to solve, a very personal and important challenge in a unique way. And that's why I'm excited to moderate our conversation today and introduce you to the rest of the panel. Melissa, do you want to start?
Hi there. Thank you guys for inviting me. My name is Melissa Paige. I'm the Vice President of the National Association of Medication Access and Patient Advocacy, and also the co-CEO of the Healthcare Advocate Summit. And that's really a conference for those in between the physicians and the patients, all about access, reimbursement, and getting access to those treatments. So thank you.
Great. And Patrick.
Hey, I'm Patrick Patterson. I run our copay card programs and call centers here at Amgen. And my background, primarily has been in sales and kind of helping the HCPs in their offices with their medications. And when I came into this role within patient access, it kind of changed my lens a little bit. I've always felt like I'm helping patients, but now I get to actually work directly on the programs that get to interface with patients and really help them with their medications.
And Deepak.
Oh, hi there, Deepak Thomas. I'm the founder and CEO at Phil. Similar to Catherine's background, I have a somewhat of a personal connection with the problem that we're trying to solve as someone who had to deal with a chronic condition sometime in the not so distant past. And then combining that experience with my professional background, which has primarily been building consumer internet and some enterprise software products, and then building businesses around those. It's somewhat fortuitous that those two experiences have come together in solving this very critical pain point in our everyday lives as consumers and specifically as patients. There's a compared to every other experience that the patient has as a consumer, this is one that's fraught with a lot of friction. And we think that technology can solve for that, and really feel privileged and honored to be able to do that and make progress with a long tail of stakeholders who are similarly committed.
Great. Well, thank you guys for joining us today. We can go ahead and get started. Patrick, I'm going to start with you on this one. From your perspective, what are the biggest challenges in the prescription process, specifically when it comes to specialty and branded medications?
Yeah, that's a good question. I'm going to put this into two kind of lenses because I think both are important. One is from my lens on the manufacturer side, right? When you think about when our prescriptions our drugs are written for patients, there's a number of hurdles that are going to kind of come in front of that patient that are going to prevent them from being able to ultimately fill the medication and start it. And so those things are like making sure that prescriptions getting to the right place, right pharmacy, if perhaps like our products, our specialty products, many times they're mandated to a specific pharmacy. The second is navigating the prior authorization process, which if the office is not doing that efficiently, ultimately the prescription is not going to be approved and then the patient can fill it. Third is cost barriers for the patient. When they get to the pharmacy, is there a sticker shock? Do they understand that copay cards are available? And then the fourth is actually just getting the patient comfortable with the medication and making sure that they understand what to do. So all of those things are different kind of potential barriers that come in the way of the patient's journey to be able to fill. Now, on the other side of that is that patient's actual experience, and the patient's actual experience sometimes is very like unknown or foreign to them. They're used to either getting like an antibiotic and going to a local pharmacy. And that's not the world we live in anymore, especially with specialty medications. Like, it's more complicated. There are more moving parts. So our ability to be able to connect with that patient and be able to kind of help them through the fulfillment process and getting started is really, really critical to our business, to being able to kind of support that patient throughout their journey.
Great, thanks. And Melissa, you see this every day. From your perspective, when you are working with individual patients, what pain points are you seeing?
I'm seeing these challenges come really twofold. There is a patient access issue. This includes, the affordability, the accessibility, the multiple forms from pharmaceutical companies or specialty pharmacies, all of them having a prescription on it, not knowing where they're going to end up. And the education around the office. A lot of these products can be ultra rare. And a lot of them are, they're cranking them out every day, so they understand the processes. So it's when you get to that product, does that person know behind the scenes of what is required to get on that drug? And secondly, you have just all the pathways for these drugs, and really understanding that the patient's really third or fourth behind the payers, the prior auths, the approvals, the step therapy, the PBM accumulators, copays, out of pockets. And so when you start stacking up where that patient is, they're going to be contacted multiple ways. And so I think, the health literacy on a pathway to a drug is different. And, I know we'll talk about it later on a little bit, but there is no one set form. There is no one set process on these things. And so you're really at the mercy of the person in that office on the phone with the payer, understanding all of these things to help out this particular patient. And, everyone's a little bit different, and everybody has a little bit different needs. And, are they speaking English, or is there another cultural barrier? So I think overall, we're talking about affordability, accessibility, and then all of the different drug pathways to get to a product. And we didn't even talk about, site of care. Where's that drug coming from, to piggyback off of you.
Great. And Deepak, we're talking to the life sciences companies and manufacturers on a daily basis. What are you hearing?
Yeah, I think that the most interesting aspect of those conversations come from this insight that what's good for the patient shows up for the manufacturer similarly, meaning the manufacturers are absolutely incentivized to see the patient on therapy the way the drug has been prescribed by their prescriber, and and the prescriber want to see the patient continue on the therapy that's been prescribed to them. The few challenges that stand between that ideal world and as things transpire today, they're mostly having to do with one way to think about the world that as it exists today is from the patient perspective. I think both Melissa and Patrick alluded to it. If you think of the patient as a consumer, which is who they are, right? And this happens to be a very specific category of consumption on their part. It is a very consequential part of their lives, and so they're intrinsically they're going to compare it with other purchase experiences that they undertake. And while those experiences as consumers have been substantially upgraded in the last 2 decades, the experience of getting access to prescription medications have fallen behind. And I think that any consumer who is trying to buy anything wants to have convenience, meaning, this day and age, that means using what I call the remote control for life, which is their smartphone that they're able to tap and pull out their pocket tap and get answers to things and buy stuff. So convenience is key. Having stuff show up at your door is important. Transparency is important, meaning what's happening behind the scenes, and which is a good segue into affordability. Am I paying the right price? So, in every other purchase experience, they're enjoying convenience, affordability, and transparency. So when we when we talk to manufacturers and essentially describe the ideal experience in those terms and how we're able to get the patient experience to match up to other purchase experiences, that's a great unlock as I see it, because by building a platform that can essentially bring together all of these stakeholders to bring the prescription experience on par with the online or de facto consumer expectation, all boats rise, including those of the manufacturer, right? So that's something that, that's unique, and that's something that we learned as we went along.
Yeah, and I think that, describing the patient as a consumer and is someone who is active in their healthcare choices as opposed to someone that healthcare happens to is an important change that's happening right now. Melissa, what other changes are you seeing about how, patients and providers are, one, kind of engaging with, the healthcare as a process, but more importantly, how it's changing in terms of digital health solutions?
I'd say over the course of 10 years from when I started in a role for medication access, not really knowing the difference between the stakeholders and the patients coming in and just the barriers, that I think today things are more easily available online with one touch of a button. And if your patient or if your other consumer, I'm going to talk about the people supporting the patient, those in the offices, can't find your tools or resources in 3 clicks or less, they're either going to push it off to the patient. The patient's going to have the same barriers on there, or they're just going to kind of take the path of least resistance and turf it off to somebody else who really doesn't understand. And so I think that patients are more involved and really reaching out via social media. I just saw one right now on a TikTok of a breast cancer patient and had 20,000 views over the next day of what she should do for her medication. Wow. And I think the misinformation that is out there too, or what worked, we've got to get ahead of that. So if you can have those resources and tools and not wait for a field reimbursement manager to come into the office to provide that training, it should be able to be picked up, utilized, shared in a way, and to be available for a patient to understand. And I know I keep hitting on, but we've got a lot of different cultures out there that these websites aren't meant for them. And so now, you're using a child to translate this information on these things. So I would say for improving or just what has been out there, the technology piece, I think to have at your fingertips and to have it work, because once again, you have a really short window on if they're going to utilize that software, that tool that you've provided, and the numerous companies that are out there trying to fix this, and it's great. And so I'm seeing that. I'm also seeing more help from healthcare workers and patients wanting to get involved in the process to help build on, what works and doesn't work, so you don't lose a patient and never know why.
Great. And Patrick, what are you observing right now in terms of, how providers and patients are changing their expectations, and particularly as it relates to digital health?
Yeah, I think it's been interesting over the last couple of years for sure to see an evolution, and there's so much activity in the space right now, actually trying to simplify the patient journey, whether it's tools that are interacting with EHR, tools that are interacting with the pharmacy. There's I think, broad range of different interventions that are aimed at trying to help the patient navigate the prescription process and fulfillment process, which is really, really good. And it's encouraging that we're going to kind of get to a new place where this, because, I think to Deepak's earlier choice, becomes a click the button, get the medication ordered. It's more of a consumer experience that is they're more familiar with. We're not there yet. We definitely have room to go, adoption to happen, and some of the solutions that are out. I think a couple of things that Melissa mentioned that are really important is consumers are, in general, more aware now of things that they need to navigate, because there's this huge explosion of high deductible health plans and accumulator adjustment programs and copay maximizers, and the patients in general don't know when they're being impacted by these things or when their employer's changing their plan. And what they see, from our lens, from a manufacturer's lens, what the patient calls us and says is, why did you change your price? Or why did you change your program? And it wasn't anything that we did as a manufacturer. We 100% want to support every patient we can with our program so they can have a successful therapy. And just navigating them through kind of what's actually happening is challenging sometimes. So one of the things that on the other side of that, the HCPs, again, Melissa mentioned, like, if they can't get to it in 3 clicks, they're going to be frustrated. So I spend some time on conversations with different groups from different types of, rheumatologists or dermatologists, et cetera. And the number one thing that we hear them say is like, hey, all of the stuff that you guys offer is really great. And it's like really helpful for us to be able to call a hub and, understand what the patient's coverage is or get assistance with a prior authorization. But each of you guys has a different process and it's really confusing and hard to navigate. Could you guys all just get together and make friends and put it all in one place? And obviously that's not going to happen in a competitive environment. But what we are seeing with kind of the technology that's evolving is, folks like Deepak see the need, and Phil is trying to build kind of this centralized repository of helping people navigate depending, regardless of which brand you're in, they can all access kind of some level of support through a centralized area, which I think is really important and a great development in the market.
Yeah, that's a great point. And Deepak, I'd love to hear a little bit from you there.
Yeah, I think that the technology has had a bit of a track record with pharma, right? And it's been a spotty one in the past, right? So there's been there are 2 trends that I want to highlight, and I think that background might talk to how tech and its relationship with pharma has evolved. Trend number 1 has been that there's been a lot of point solutions, right? So that means that there are specific solutions for very narrow problems. One of the things that is worth pointing out is when it comes to the patient experience, it's really not a point solution. The patient experience is the way it is today. It's a manifestation of a lot of missing pieces, a lot of 3 issues in general, right? One is incentive misalignment. There are workflow inefficiencies among the stakeholders, well-meaning stakeholders who don't know what they need to do and what they need to know, which is, you call that information asymmetry. So those 3 issues exist, and they are across the board, right? It ranges from the prescriber to the pharmacy, to the payer, and of course the patient and the manufacturer. Little known fact to the public that the manufacturer is very involved in getting the patient on therapy, right? But they all have these stakeholders that work together. So there are information gaps, workflow inefficiencies, and there are lots of other intermediaries that we didn't touch on. And then the question of incentives come up, right? So this is a systemic problem. For systemic problems, you have to have a solution that spans the system. So you can't necessarily just have these sort of presumptuous magic bullet solutions or point solutions, right? So they have to span the gamut of the workflow. So that in the past has been not the typical approach from technology vendors, right? So they sort of take this very narrow view and they solve for it, and that's better than not having a solution. The other issue has been healthcare is such a complex space. You can't take technology that's been built for a CRM platform, what have you, that's been built for other less regulated spaces that have less protection around consumers, and just assume that they will automatically work. A good patient experience means navigating all of these requirements that are unique to the space, and then building a very flexible workflow that's unique to the patient, unique to that particular drug. That requires a platform that's modern, that's flexible, built bottoms up, and obviously need to span all of these stakeholders, right? So we have certainly taken that perspective, and that's somewhat of an ambitious undertaking, right? You got to build across the entire ecosystem that spans at least half a dozen stakeholders, And some of the solutions are not just technology related, right? The technology is not utopian. It's not a silver bullet. So how do you bring together incentives? How do you bring together a solution that spans stakeholders? That to me has always been, like a presumptuous silver bullet here, if you want to call it that, right? And I'm seeing that there are folks that are thinking in those terms, and that's very welcome, and we certainly have taken that approach. The consumerization part, where there are a lot of companies that believe that it's necessary to get patients and their experience is upgraded to that of today's consumer, that's on TikTok, that's on their mobile phones, right? So that's happened a ton. But the part around, many of these medications are such that they're not direct to consumer. that prescribers got to be involved, payers got to be involved. So I think any solutions that don't really take those into considerations, they might fall short, right? So generally speaking, really good trends in the right direction. Yeah, very, very encouraging.
Great. And, Patrick, as you're thinking about the, idealistic view of, one central way that people can access medications across, all manufacturers, that's probably not, realistic in the short term. But what types of requirements are you looking at, and what types of, features are you looking at when you're evaluating digital tools for your brands?
Yeah, I think Deepak was hitting it on the head there. It's how can we best combine, these like separate, disparate actions that need to happen for a prescription to get covered, and combine it into a more simple kind of at least starting point, or put them together so that we can kind of more effectively help the patient. So when I think about an ACP office, a lot of the folks that we might interface with directly in a support model, in addition to patients, if you think about what an HCP's office has to do to get a prescription written, it's write the prescription, do the prior authorization, help the patient with affordability, hopefully, if they're willing to kind of get the patient to the PSP, and then kind of help the patient navigate. And if you can kind of put those 4 separate actions into kind of more of a unified, centralized process that the patient is used to, leveraging their mobile device, leveraging systems and things that the HCP is already doing within their existing workflow, then that's really important. So finding a starting point like e-prescription, which every office pretty much has the ability to do, linking them into kind of a model that can then connect the patient, the HCP, the pharmacy in the right way. That's really what we're trying to achieve, thinking about technology simplifying that experience. And really importantly, and I can't stress this enough, is letting the patient know where they are in the process too.
Yeah.
Because that's, I think, oftentimes from a manufacturer lens, we think about these hurdles as things that we need to solve to make our medicines available. And sometimes the patient's understanding gets a little bit more lost than we would like it to. And so keeping the patient kind of in that communication cascade, letting them know the pharmacy is working on an authorization, letting them know that they should check out, a website, or, check out an additional resource that may help them with affordability. All of those things are really, really critical to making sure that they have a successful start on therapy.
Great. And Melissa, when you're thinking about tools to help patients get access and the sort of things that help you and your teams, what requirements are you thinking about?
I think my keyword for this is redundancy, and we don't have a lot of time in the office for these things. So when you're filling out a form for a foundation, for a benefit investigation on top of the PA forms, I think the redundancy, so the technology piece behind it is nice because it's either once in there and it kind of feeds to where it needs to for that particular patient. I think from us trying to know the level of effort behind whatever process we're going to put in place for a particular product. Is it truly going to help us get to the end result faster? Are there tools and resources out there from the manufacturers that we would like to see, such as a quick BI. Like, let's not get the patient involved because I don't want to set their hopes up if it's not even possible, or, you know, something with their payer policy. Just letting them know what the next steps are, because it's really disheartening for every patient that I just have to say, expect for it to get denied. Don't worry, here's the next steps we're going to take, because you want to keep that patient involved, actively involved. And the digital solutions for us, when trying to implement them for a large health system, it always came down to the expense, right? Like, how is that model for the hospital? What are they going to get on a return for it? And for the healthcare workers, for us, we just want something. So I think shifting some of this over to a more, not a free model, but just a more transparent model for the health systems, and having those behind the brands and the products help support this, I think will make the conversations go a lot easier and faster. And also that patient engagement piece too. And I do agree with you, Patrick, that I believe patients need to understand where they are, because that's also redundancy of phone calls to multiple people. You've got patient engagement personnel from pharma, you've got people from the pharmacy calling, and everybody's kind of saying a little bit different. So, you know, who holds the truth? And I think with the technology solutions, what we want to see, even for a all-in-one solution, is the status and substatus appropriate for me to know what's going on for that patient journey? And for example, closed. Is it closed because it got sent to patient assistance and that's a different team? Is it closed because the hub's cadence is 3 calls and we close the case? You know, so these typical things that we hear of closed or approved, my favorite is approved active on product. And that was just set in the CRM system or the portal. It doesn't mean they're active on product. They're active on product when the needle goes in the arm. So I think some of these things, if we can kind of have it in one area where you don't have to have a follow-up call. I shouldn't have to be a advocate in the office holding the hub's BI saying, okay, let me call on this and really see what this means for that. So I think just anything to do with digital, we're trying to do digital to bring less questions, not more questions about now the digital tech solution.
And digital mobile is really critical, right? It can't be digital portal, because nobody wants to use a portal. Nobody wants to download an app. They want it on their phone, because that's what they're used to with every kind of communication mode right now for any kind of consumer brand. So mobile is critical.
So Melissa, a ton of good points in there. I was ticking them off, the ones that I wanted to follow up on. So the first that we haven't addressed yet in this conversation, and I'd love to hear from Deepak on, is the cost associated with that, and how, you know, it's not how we manage that and make sure that the tools that we're bringing in are affordable and not passing additional costs on to the patient.
No, I think that the cost of the tools per se, to me, I would put it this way, right? The manufacturers have already invested a ton by way of patient access, right? If you were to look at, say, a program like the umbrella programs that Amgen, Patrick's employer, would have in place for a therapy, fairly new therapy out there. They run the gamut of copay, you know, patient access /hub, nurse line support, adherence support. So there's a lot out there that's essentially committed to resources and capabilities, committed to helping the patient get to access. I don't think the pricing around, you know, these sort of technology platforms should be borne by the consumer. To me, you know, these technologies should expose those services and make them easily available to the patient. That's the role of these are all, you know, like, none of these services are charged to the patient, right? They are put in place such that the manufacturer underwrites the cost thereof, and with the intent of getting patient on therapy. I do want to say that you know, the adoption, I think Patrick and Melissa kept alluding to this, right? Adoption of anything new is there's a little bit of a conviction hurdle to get over, right? So you know, I can go in and tell anybody, especially someone who, if you look at the typical HCP office, it's understaffed, with not enough hours in the day, right? So to go into that environment and tell them, that there's light at the end of the tunnel, but hey, let's start with, we'll help you with paperwork to meet pay requirements, but let's start with a 4-page form, or, we have this fantastic new therapy, and we have built a portal for it. All you got to do is, learn how to use this portal. So there is that sort of, conviction hurdle that they have to get over at a time where they're already strapped for time, right? So, so any of these solutions, I don't think price is an issue, adoption is an issue, especially with the prescriber, right? And I think whether it's the prescriber or the patient, you can overcome adoption hurdles by mimicking what's familiar. So if it is just a stone's throw away from what I'm already used to, then they take to it pretty quickly, right? So how do we do that within Phil? We decouple user interface from the sophistication that needs to be in place to solve a complex problem, right? So meaning all of these entities need to talk to each other. That's not easy, right? Because a plan may have a certain set of requirements. Another plan may have an entirely different set of requirements. A given specialty pharmacy might have a different processing flow. So how do we abstract those in a way? How do we build around that and build to support it, but in a way where the user interface is similar but also familiar, right? Because otherwise you'll fail with the adoption challenge, right? So with patients, that means to Patrick's point, it has to be something wherein my hurdle rate for adoption is a 65 and older demographic. So if I can get 85 to 90% adoption of our platform, then the rest shall follow easily, right? So for that group, my thinking is always, what are the two things? Today's 65-year-old was in their 40s when the smartphone was invented, so they're familiar with that, but they can't download an app, and they may be less conversant with it, the average 65 or 70-year-old, but they can use their the messaging app, they can use their browser. So you rely on very, very least common denominator set of technologies to build a lot of sophistication underneath it. You don't want to create sophistication in the user interface. It's got to look like the iceberg, right? So 10% that shows up above the water should be familiar, and the complexity beneath the surface, right? Same deal for the prescribers. So a lot of folks, when I say this, smile when I say that the most familiar technology at the prescriber's office is the fax machine. There's nothing wrong with that, right? I mean, you can get the prescriber to move on to something that has a better user interface if you can deliver value for them using that interface that they're already familiar with. You have to earn the right to get there, right? So we say, okay, the e-prescription system, already familiar with, not having to learn anything. The fax machine, that's been a mainstay at an office. And then, EPA tools, right? There are several good ones, and there's one that particularly comes to mind, CoverMeds, is exceptionally good. They've done exactly that, right? Abstracted away all plan-specific requirements and presented a clean user interface. So, to me, relying on what the prescriber's office is already familiar with, I think is a great way to overcome that barrier. And then, the price does not really matter, because I think, as I mentioned earlier, these tools are already, it's not an investment issue or a pricing issue. I think it's an adoption issue more than anything else. Yeah.
And I think, Deepak, ultimately, if this is making it simpler for the patient to get to their prescription, right? There's almost a cost of not doing something that's more elegant, that's not intervening more, because you're ultimately going to lose that patient. That patient's not going to be successful on their prescribed therapy.
Yeah, I think that's exactly right. It's like the fully loaded economic cost, right? I mean, it's not so much it does it cost me $1 to download the app, right? The opportunity cost of me not being on therapy and how that shows up for the insurer, and then for the individual patient and the broader society, right? I think that cost is tremendous, right? And it's, again, we don't take a narrow view, right? And we take the broader view, these investments, whether by the manufacturer or by third parties to help patients get on therapy, immense value to be unlocked.
Well, I'd like to add, we keep talking about that patient journey, that over 65 journey, and really these journeys really need to look at the lens of like the family journey, right? Who's supporting now that 65-year-old? What does your tech solution look like with shared access so others can be in loop and not calling grandma to see if she got a phone call from a pharmacy and she talks to anybody, giving her social to, Walgreens to go pick up some gift cards. So I think the opportunity on the communication of with the family journey and not overburdening that patient with a rare disease, we need to get all different champions in here to read this who may be a little bit more accessible. So I think we've got a long way to go, but I'm seeing a lot of exciting things come. And, when we're down to discussing right now of should we charge patients for my chart messages because they send too many or too less, we need to, I think, attack this from the front even before it gets to those my chart messages.
Mhm.
Absolutely. And so I think, we've talked a lot about the potential, but I'd love to hear, Melissa, starting with you, what are you most optimistic about as, this process evolves, and what do you believe is essential to really ensure that the process continues to drive better outputs for patients?
I'm optimistic that the stakeholders trying to provide the solutions or figure things out are really looking at each other, not as competitors, but as, I think the term is like willing rivals, right? Like, what are we doing? Because these tech solutions are being utilized everywhere. A lot of them are actually faced for health systems. Not a lot of people have really put the emphasis behind those private practices that are still trying to look for something. So I think for any tech solution, they should be providing all and above, because you never know where that's going to live for that price, for that adoption rate, right? Who's in that office. And so I'm optimistic that the people behind helping out the patients are understanding the patient access journey a little bit better with patient engagement leads, with field reimbursement, key account managers, just all these stakeholders. And so we talk about health literacy. There needs to be a pharma literacy that I'm seeing done more and more. And that's really what we hone in on the conference side of things. It's not, we don't even talk about a specific drug. It's access is access, and a barrier or a site of care denial is the same. And what are the challenges and who do you pull in? And networking, right? You need these people, and you're going to have some very sophisticated offices that Patrick won't call your field reimbursement managers unless things are on fire. And then you've got offices that need a lot of hand holding. So I think even appropriately, just kind of rating these types of offices, and even that needs to be done with, how much time do they have? Do they have options to turn on and off alerts from your portal? And who needs what to whom? So I think as the technology is being built out, which I'm seeing, it's providing a lot of those things that I didn't have 10 years ago. And, I joke, but I did have 72 logins by the time I left the health system. And that was for every portal. And I was pro portal. I was pro all in one form because I didn't want to have to fill out another one. So I'm glad to see the users possibly don't have to have 72, maybe 70, but we're moving in the right direction. So I think if you could just get those involved who are utilizing your services and your tech solutions, they'll be your biggest champions, even for the C-suites and for the head office. So those are the ones we need to get involved in to really champion these solutions, because then they'll tell their patients about it. And it's, more or less word of mouth.
And Deepak, what are you most optimistic about?
To me, I think the 7-8 years ago, the idea that if you're able to build a system that ultimately results in solving for the big three, meaning affordability, convenience, and transparency, that lifts all boats, that's no longer a hypothetical. I'm very optimistic that if you take that approach into other therapeutic areas beyond the ones that we are involved in, and even into classes of medications beyond the ones that we're involved in, there is a ton of success to be had, right? So we're in the very early innings of it. I have seen enough proof points to believe that in the next 5 to 10 years, the way that access is going to be shaped it's going to be vastly different from the last 20 to 30 years before that. So I'm super optimistic about that. I think that the proof points range from 90% of, in some instances, as high as 95% of patients who've been prescribed a therapy actually getting on that therapy. So that to me, you can build all the systems that you want, and ultimately the proof is in patient experience, right? And so that's always been our North Star, and that's what's encouraging, right? And have us go at it day after day, because the adherence rates have gone up, the long-term adherence rates have gone up 5 to 6 times higher than what's typical or average across all dispense channels. The little known connection between affordability and getting the drug covered by the payer because all of their requirements have been met, and the technologies that lead up to that. I think, again, the affordable script is often the script that is covered by the payer, right? If the patient has to pay out of pocket, most often it's not affordable. So, and affordability and access are intertwined in that way, almost inseparable. So there again, we're seeing that a system that has connected all of these stakeholders that need to hold hands to meet the payer requirements and enabled by technology, when it works really well, as we have been able to demonstrate, that results in a lot more patients getting on therapy, right? Very, very encouraging signs. And then the fact that manufacturers previously had to operate with very little and certainly not timely and complete data sets to inform their decision making, to a world where now they're able to rationalize the services that patient access services that they're able to put in place. They're able to see how it works. They're able to change the services up in a way that reflects the lessons learned after they've been deployed. All of those are, proof points that were merely hypotheses as recently as 5 to 7 years ago. And like I said, very, very early innings. We only where we are today, we only affect a small, very, very small percentage of the prescription drug market. I think that there is a lot more lives to be influenced for the better, right? So very, very optimistic about that.
And Patrick, I'll ask you the same question.
Yeah, I think the 72 number Melissa mentioned is pretty crazy. I think making something more intuitive is like what I'm the most excited about. If I think about what we see in the marketplace right now, and especially because of the pandemic or post-pandemic, where employment is at right now, we see a tremendous amount of turnover in office staff. And so if you think about trying to train somebody in the old system that Melissa mentioned that has 72 different logons and different things that she has to access, that's a pretty daunting training experience, and it takes a long time to get acquainted. So if you kind of pull back from that very complicated, very disparate kind of environment, and you can go to a very simplified, centralized environment, that's ultimately what I'm most excited about. Because if we can make it easier for the HCP to navigate, we can make sure that the patient knows what's happening, and the manufacturer's there to be able to support the patient, and those three are kind of on the same page. I think ultimately everyone will be a lot more successful in helping treat patients' disease, and I think that's the end goal. Absolutely.
We've had a few questions that were emailed from attendees today that I wanted to make sure we cover. The first question is, oftentimes patients are confused and scared when they're getting prescribed specialty medications. How can a technology-driven process support the human aspects of their condition? And Deepak, I'd love to start with you.
Yeah, when you're prescribed a specialty medication, more often than not, you are going through something that that brings you that much closer to realizing your own mortality in some ways, right? It's not a it's a time that's fraught with a lot of anxiety, and the ideal process, one that doesn't add to that anxiety, right? So sometimes it might be economic anxiety. Can I afford to pay for this drug that my doctor needs me to take for me to get better? Will I get it on time such that I'll get better? All of those are, important questions, right? So, and specialty, compared to, say, a generic product, which might be treating a chronic condition, that quote unquote anxiety is heightened in comparison, right? So, whatever we can do, two things, right? Whatever we can do to alleviate those anxieties around the uncertainty with the process and how technology can keep the patient informed. I think it was Melissa or Patrick that mentioned the need to keep patients informed, right? Sometimes, the patient, not sometimes, oftentimes the patient is simply unaware that someone's working hard on their prescription. In the absence of good communication, they would conflate that with someone hardly working on it, right? Which may not be the case. Someone might be on trying their best to get them on therapy. It's a new process for that patient, especially when they're on that drug for the first time. So how do you sort of keep them informed when a PA is being worked on, if there's an appeal involved? What can I expect as a patient? That's important to know, right? And tech has been exceptionally good at that, right? We communicate as a species, we communicate, I would say 100 times, 2 orders of magnitude more than we used to before the year 2007, right? And that's because we have this mobile device that we can carry around, right? So why not leverage that to assuage anxiety at a time when it's heightened, when you are being prescribed a specialty therapeutic? There are several more, but I'll stop there. Yeah.
And then Melissa, did you have any thoughts there as well?
Yeah, I think with technology, there also needs to come with alerts, because after every action, after every denial or approval, there comes a letter. There's still a very manual piece to this, that 10 things may have happened by the time the letters get to the house. And so I see a lot of confusion happen with that. So while we're doing tech, how are we not also attacking hey, you should be getting a letter in the mail. Don't worry about this, whatever the title is. So you're not heightening their fears already after getting this diagnosis, and whichever diagnosis, and no patient really ever can plan for some of these diagnoses. I don't care how much money you spend. We're at the mercy of our payers, the insurance that we have. And with the prior authorization process, I think just letting them know where they fit in the journey, second and third effects of why we need a call back to answer this, like where their responsibility is in this, so we can move on the next step, I think would help them as well, just with the prior auth journey. And the same thing, for the tech, or not the tech, but the offices. You've got this tech solution, but I want to know, Melissa, Paige, what touch points you had with my patient, because you've got offices saying, don't touch my patient, you're going to mess up everything. I've already got it down to the point. I don't want any patient engagement lead to help them. They make things confusing because they know their patients well, and they just don't, every company is doing things different. So I think you've got the tech mirrored for the Patricks of the world, who needs all of that data to make actionable, moves within the programs that he's supporting. You need patient facing, you need office facing. So I think this view from all stakeholders of where that is, and making sure that message gets across, would be very helpful with the tech. And I see that getting there. We see a lot of things even with our own apps that we're using right now, but just the prior auth process, I think the first step is explain what a prior auth is, explain what a predetermination is based on whatever payer, give them a heads up that there could be potentially other medications, because once they hear that drug, they think that that's going to either cure or solve what they have. So when we have to go back and tell them, hey, we're actually going to try you on this one instead, any patient's like, well, you wanted that one, so what do I need to do? That it's already in their head of, this is what was going to help me, and now I get second choice or third choice.
Right.
They may all be great. It's just the preference. So you've got the patient you need to keep engaged and overall feeling good about the choices, the money that they're spending, and the options. And that's how we would approach every patient. I would say, look, if we hit this barrier, and even prescribers prescribing the product, you talk about prescriber confidence, they need to know what happens with their commercial patients as well as their Medicare patients. And will they ever really truly hit a barrier that would make them switch? And so I think understanding the beginning and the end and where everybody fits in is what tech can help out with. And that would help out less phone calls and emails coming from Melissa Paige, bullet pointing something that's very complicated that nobody will ever read.
Yeah. And then the next question that came in, Patrick, I'm going to direct to
Sure.
you. As a brand, we're spending a ton of money and time on patient access services, but we're seeing really low uptake. Things like nurse lines, patient assistance programs, et cetera. How are you making sure that these programs that you've designed to support access actually get into the hands of the patients who need them?
Yeah, I think it's a great question. We always want better penetration of programs for sure, right? We want to touch as many patients as possible, support them through the journey. And I think it comes down to simplicity. So we're already leveraging some layers of technology, right? So we're using QR codes for enrollment, things that can be used in the HCP's office to make enrollment in our support services a little bit simpler, more timely, reducing the time it takes to kind of go through a web page, for instance, for an enrollment or a call. But the hardest patients to treat or to support are the ones that never hear about our services. And I think that's always been the biggest barrier, is figuring out a way to make sure that offices are actually letting patients know about the services. In our particular case, in the specialty market, pharmacies tend to be a little bit more engaged and let patients know, oh, there might be a copay program available or something else. But that's not necessarily universal across all kind of, therapeutic areas. But once we are engaged with the patient, it's just figuring out kind of the best way to kind of set expectations. I think a really good thing that Melissa said was, like, they don't understand the prescription approval, process going through. And in fact, like, one of our, internal marketing, like, somebody that's much smarter at marketing than I am, is like coined the phrase the parking lot moment. And it's the moment kind of the patient leaves the doctor's office with a chronic disease diagnosis and a prescription for a specialty medication. And they kind of sit there and all of a sudden reflect and go, oh, has my whole life changed? Like, what's going to be next? Is this therapy going to work for me? Is there going to be side effects? Can I afford it? Like, all of these things start rushing through their mind. And they don't even know where square one is to start if the office didn't do a good job setting up expectations for that journey. So if we can get in touch with more patients to help set those expectations, that's great. Or if Melissa's teams can get in touch with more patients to set those expectations, just understanding the journey and the path is really important to making sure the patient's successful at getting started.
That's a really, really great point. And Deepak, from a technology perspective, how are you thinking about getting more patients visibility and access to those sorts of programs?
Yes, so there are programs aplenty, right? I mean, there are nurse lines to FRMs to adherence management. So it's not the lack of resources that have been committed to it, right? But it's sort of it's a communication problem, as Patrick described it, right? It's like there's this question in philosophy that is, if a tree falls in a forest and no one is around to hear it, does it make a sound, right? Meaning, you can have a very sophisticated nurse line, nurse support team in place, but if they're only as good as them being made available to the patient and the patient being aware of it, right? So I think tech is particularly good at solving those sort of information problems, right? And that means If the hub is technology enabled, then the hub is not calling the patient from a 1-800 number, which this day and age most consumers, i.e. patients, ignore, because we all know I keep count of these things. So before afternoon, there's at least a dozen calls that have simply not picked up because they're not from familiar numbers, right? So I think as the services evolve in terms of their sophistication, and manufacturers commit more and more resources to support the patients, those commitments are only as good as the awareness around those, right? And I think tech can really solve for that. So as to make it more concrete, rather than a call, the enrollment is mostly digital, and digital enrollment doesn't require a lot of barriers like apps, etc. It's a familiar user interface, and you get a text message before you get to the parking lot, and you click through that, and you enroll into, to a nurse support program. You sign up for your copay. You sign up for the Sharps container program. You are set up for success as a patient, right? And I think it's such a easy thing for tech to solve. And when you bring these two things together, great intent and a lot of resources with the means to get it in front of the audience that will actually benefit from it, great things happen. We've seen it, and my conviction comes from having seen it, right? So yeah, very doable, and yeah, does not require much of a learning curve. Yeah.
Well, thank you guys all so much for the conversation today. I'm really optimistic about the potential and what we're currently seeing from existing programs for technology to really drive an increase in patient outcomes. And I think it's an evolving conversation, but for everyone on the phone with us today, please let me know if you have any questions. You can send me an email at catherine@phil.us. I will send an email in follow-up with a summary of our conversation today, as well as a recording that you can share out with anyone on your teams who may benefit from this. Additionally, I'll follow up to see if you guys have any questions and potentially set some time up for us to have a conversation around how you can potentially use technology to improve your access programs. I really appreciate everyone's time today, and thank you very much.